It's a distinct privilege to have with us today Dr. Roger Seheult from Medcram. He's also a quadruple certified physician in internal medicine, pulmonary disease, critical care, and sleep medicine. Welcome to the show, Dr. Seheult.
Thank you so much.
And today we're going to try to tackle a very interesting and timely topic, and that is immune optimization. What is it that we can do in our daily life, in our daily habits, that would help us have a better resistance against infectious disease and diseases in general? This is purely for educational purposes. Any recommendation, you should talk to your healthcare provider, make decisions based on your individual situation with them. We are informing and educating here. And as we open this discussion, I wanted to challenge you with a question, Dr. Seheult, and that is, do you see the idea of boosting the immune system as a valid one, or are we more referring to optimization, to balancing things the right way? How do you see this?
I think boosting is kind of a simplistic term. The immune system is far more complicated than just a fighting force. There's times when the immune system has to be on and doing what it needs to be doing. And there's times when the immune system needs to turn off. And if it doesn't know when to do one or the other, if it's not being modulated correctly, then things can run bad. I mean, you can have immunosuppression, and that's a bad thing. And you can have over autoimmune conditions, and that's a bad thing as well. So I like enhancing the immune system, optimizing the immune system, as opposed to just saying boosting the immune system.
Thank you. And we're on the same page. Oftentimes I hear patients coming to me. I practice outpatient internal medicine in Southeast Washington State. And almost daily since COVID started, I hear patients say, "Doc, what can I do to enhance or to boost my immune system? What can I take?" And so this is an issue of taking this and that, the magic, mix of ingredients or supplements, or is it more than that? How do you see this?
Oh, it's way more than just taking supplements. It seems as though the human body or the human being feels like unless they're taking a supplement, then they're not really doing what they need to be doing. But there's things that are so simple that the human body can engage with that will dramatically improve, and we have science to show this, dramatically improve the performance of the immune system and the performance of the body in so many ways that it's hard to believe.
And I've been a fan of your YouTube channel, Medcram, for a while now, and you guys have been publishing what I consider to be high quality, extremely informative and accessible at the same time, not just for medical students and medical professionals, but even for the public in general, news and items on these topics for the last 2 years now, right, since the pandemic started. But you started Medcram, you're a co-founder many years before that. What was behind that, briefly?
So I had a PA student, or a physician assistant student, named Kyle Allred, who had this dream, this idea that medical education needed to be a lot more than it was back in 2012. There was a lot of PowerPoint presentations, people just reading. There wasn't an engagement. And so when he became my student and I started to teach, he thought I was the perfect combination of what he envisioned. And we worked off of something called Khan Academy, which you may be familiar with on YouTube, where professors draw on blackboards. And so we adopted that. And the primary purpose was to have a way of flipping the classroom so that students could instead of coming to class and having a two-way interaction with the professor and then having to go home and figure out what they wanted to do, is to do that first at home with videos that we would produce, and then they would come to class and interact with the professors. That grew very rapidly from 2012. We started a website. We put on courses, not just for students, but also for physicians. We offered continuing medical education. And then one day, my wife said, "Hey, this new virus in China, maybe you ought to make a video on that." And we did. And of course, there was a tremendous outpouring of interest from the community and from the world that were interested in a virus. And really, for the first time, instead of basketball stars or baseball stars or movie stars being at the forefront of media, it was us geeky scientists all over the world that had something to offer about COVID-19 and viruses.
Well, and it sounds like you well owned in even before that with this quadruple certification, right? I mean, you've been passionate about medicine, I suppose, and health education, it sounds like, too, for a long time now.
Yes.
All right. So briefly, before we return to the topic, I took a tangent here, but where do you want to take Medcram moving forward?
That's a good question. You know, we discuss, Kyle and I, who are co-founders of that, discuss it all the time. Who's really our audience? And we do feel that healthcare providers will always remain at the core of our audience, and giving them good quality education in the medical field is going to be a key. But we're also interested in educating the public on, you know, basically simple remedies, simple things that you can do that will optimize your immune system and optimize your health and your body. And we'll talk about some of those things here probably.
Well, let's just delve into it. So
yeah.
Let's start with diet, because this is such a huge topic and it's controversial and everybody has their own thing when it comes to that. But as far as you can tell, what is one or two things that come to mind when we talk about optimization immunity through diet?
Yeah, so I would say to start off with, the tip would be to eat less and to eat more plants. And that's really it in a nutshell. It's difficult to do the type of studies that we would normally have, like for instance, with drug medications, randomized placebo-controlled trials. That's the best kind of evidence, because you can't assign somebody to a specific diet randomly to do that, you know, indefinitely for a long period of time to see the kind of results that you would need to see from diet. And so either
how do you make a placebo apple?
Exactly. So you either do a randomized controlled trial in diet for a short period of time and pick up some surrogate markers that you can identify, or you let people eat what they want, but you just track them for a very long period of time. Now, both of those types of studies have their flaws, but you sort of have to go with the flow. And you know, there's a number of studies that have come out, whether it's the Adventist Health Study 2, whether it's the recent UK Biobank study that looked at, you know, over 100,000, hundreds of thousands of people in that study.
Do you see in those studies a fairly clear relationship between a certain type of diet or certain foods and beneficial or negative effects on immunity?
Yeah, definitely. And the relationship is the more animal products that you have in your diet, the more issues you have with metabolism, diabetes, metabolic risk. I mean, it's pretty clear. If you look at the Adventist Health Study 2, basically there was a stepwise function as you went from vegan to vegetarian to pesco-vegetarian to semi-vegetarian to basically non-vegetarian. As you went in that direction, the BMI went up, the risk for diabetes went up, and it was controlled for BMI. So it's not like you're eating more calories in these diets. When they controlled for the amount of calories that you ate, when they controlled for the amount of BMI that you had, even controlling for all of those variables, the diet itself, the quality of the diet, increased the risk for diabetes. You look at the Biobank study, UK Biobank study, huge study that was just recently published in the last year or so. It showed that eating red meat was associated with the increased risk for atherosclerotic disease, heart disease. Now, for years, there's been this debate back and forth between Europe and the United States is looking at whether it's processed meats versus red meats. You know, one study seemed to indicate that it was processed meats that increased the risk for diabetes and hypertension and specifically cardiovascular disease. But this Biobank study basically showed very elegantly, very unequivocally, that it had nothing to do with processed meat versus not processed meat. The idea was any sort of meat, 3 times a week, et cetera, that was associated with increased risk for cardiovascular disease outcomes. And that's a very large study. Again, pretty clear. What I have found interesting, very interestingly in the last couple of years, is scientists have tried to figure out, well, what is it about red meat specifically? And red meat is basically, you know, mammalian meat. It's non-human mammalian meat that we're talking about. What is it about that specifically that is causing an increased risk in cardiovascular disease? Now, in that Biobank study, they saw a connection between white meat, so like chicken and fish, It wasn't to the same degree. There seems to be something about red meat that is particularly inflammatory to the human body when it's consumed. And I think the answer may lie in this sugar called sialic acids. Sialic acids are 9 carbon sugars that are put at the end of the polypeptides. If you can imagine the cell surface, and you've got these glycoproteins, which are like your hand, and then you have these glycoproteins, which are fingertips. On the very tip of your fingers are these things called sialic acids. Sialic acids are actually really important. They're one of the things that the influenza virus uses to dock and enter the cell when it infects. It's also one of the things that your immune system looks at and recognizes. And very briefly, without getting too technical, the human body makes one type of sialic acid. It's something called nu-5AC. That's the name of the sialic acid. It only makes one type of sialic acid, nu-5AC. But just about every other non-human mammal, with very few exceptions, makes both nu-5AC and also something called nu-5GC, which is a very similar sialic acid. It's only off by 1 oxygen atom. It's very, very similar, but humans don't make it. What's interesting is that when humans eat pig, cow, even cheeses, so it's in all of the cheeses as well, from goats, all of those non-human mammals, basically, when you eat it, the body digests the meat and all of the products, but it doesn't break down the sialic acid. Instead, what it does is it reabsorbs it. And so now you have this nu-5GC, which is a sialic acid that the body does not make, circulating around in your body after you eat this meat. Now, the enzyme that puts these sialic acids onto your own cells can't tell the difference between the nu-5AC and the nu-5GC. And so when it starts to put on these sialic acids onto your cell surface for recognition in your immune system, you're going to put nu-5GC where you would have been putting nu-5AC. In other words, the surface of your cell starts to resemble the surface of a cell of the animal that you ate, as opposed to the cell surface that you actually are.
So if I get this right, to use your analogy to the human hand, the very tips of the fingers, almost like the fingerprints of those cells in people who eat habitually red meat of some sort, or cheeses from those animals, or dairy products, it transforms almost the fingerprints of those cells in such a way that the immune system comes and doesn't recognize them quite properly and triggers an inflammatory reaction in there.
That's exactly correct.
Do we have evidence that this is actually causing pathology?
Yeah, they've known for years that consuming this type of meat increases the risk of colon cancer. I mean, the WHO has classified red meat as a carcinogen. It's very clear that there's a connection between those two. What hasn't been really connected is whether or not it's the sialic acid as the mechanism. There was a very elegant research study that was done in France. I'm glad it was done in France because they were actually able to meticulously take a survey of many subjects in this study about exactly what they ate and how much of it that they ate. So dairy products, yogurts, cheeses, they even broke down in the study. You can see they have a table of the different types of cheeses that they ate, because all of these different animals, all of these different cheeses have varying levels of nu-5GC because it's a genetic thing. It's not how it's raised. It's not if it's grass fed. That has nothing to do with the amount of GC that's in the animal. It has to do with the genetics of the animal. Of course, that can't change. And so what they found was when they were able to do these very detailed surveys about what they ate and how much they ate, they came up with something called the Gc Emic Index. In other words, okay, here's this person who eats this. Based on our calculations of how much GC is in this food product, this is how much GC should be in their body. And this is how much GC should be in this person's body, et cetera, based on what they're eating. And then what they did next was they were able to take their blood and their serum and isolate down the amount of anti-GC antibodies. And they were able to show very elegantly that the more people ate of this nu-5GC, the more antibodies against that GC they had circulating around in their body. And what they said is that this causes something called a cyalitis, a xenocyalitis. The word xeno, xeno, is different species. So this different species inflammation related to cyalic acids or xenocyalitis was what was happening in patients who were eating basically animals that had a high amount of GC. And this showed very elegantly that diet is associated with inflammation, and we know that inflammation is associated with cancer and atherosclerosis. So I think it was a groundbreaking study. It was actually published in 2019. I think it probably got lost in all the buzz of coronavirus, but it's something that's really interesting.
I sense that the day when we will see red meat from GC knockout animals is not too far down.
Yeah, I mean, there isn't any GC in fish. There isn't any GC in chicken, poultry or eggs. But we know that even these food products are associated with some degree of cardiovascular disease based on the epidemiology studies, but not as much as we see with red meat. So this may be the motivating factor. And what you really want to try to do, as you'll see over and over, the theme is going to be coming up over and over again in this discussion that we have today, is that inflammation is something that you don't want to have if you don't need it, because inflammation is going to lead to problems down the road when you get infected with viruses.
And this leads me to the next question about diet and eating, and that is, you just gave a great example of what can be pro-inflammatory, causing inflammation with this xenocyalitis. Are there other foods that perhaps do the opposite?
Yeah, anything that's colorful or ends in the word berry is extremely powerful as an antioxidant. Blueberries, elderberries, strawberries. There have been some studies that have shown that eating a small bowl of berries can actually have a measurable impact on the pain in somebody with osteoarthritis. Just to give you examples there of how packed full of antioxidants that these types of fruits have.
What you just said brought to mind the idea of, there's always this incentive where you hear about, polyphenols or whatever.
Yes.
To extract, concentrate, boom, you have a supplement and you can sell it. Is that the best way to go about this?
No, I don't believe so. It's a fallacy that I see all the time in medicine, where we find something that seems to work and then man tries to extract it and use it by itself. It's been shown to be incorrect. I can give you an example that's near and dear to my heart. Sure. In the world of pulmonary, which I'm a pulmonologist, is we saw epidemiologically that patients with lung cancer seem to do better when they had diets high in vitamin E and beta carotene. And this was seen very early on. And so what they did was they did trials where they actually extracted vitamin E and gave vitamin E and beta carotene in high doses to patients with lung cancer. And what they found out was that they actually did worse when they did that. So they stopped those trials very early. I believe that these things are working very well in conjunction with other things that they're packaged with. And really, that's the best way to get these things delivered rather than having these things isolated.